안녕하십니까, 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won. Today we're going to review online surgery. This is the patient of the day. This is a female patient in her 40s. In December 2021, when the patient first came in, if you look at the panoramic image, number 7, it's quite impacted. The chief complaint the patient had was that there was intermittent pain here, and in the posterior right side, there was gingival swelling. The patient visited many dental clinics, so she knew the necessity of extraction. As you can see in the panoramic image, number 47 was quite significantly impacted. Number 46 was extracted when the patient was younger, and number 48, it's overlapping. If you look at the antagonist, number 17 was extracted, number 16 was quite extruded. The patient, based on her understanding, number 46 and 17 were removed. She didn't exactly remember when. If you look at number 7, I am assuming that number 6 was removed when the patient was quite young. Unique thing about this patient, the patient went through treatment due to rectal cancer 3 years ago. The patient went through radiation therapy and chemotherapy. The patient is fully cured, so it's just another patient history. It's not going to be a problem for us. The surgical plan is to extract number 47 and 48, which are impacted. Oss Collagen and OneGuide is going to be used for socket preservation, considering antagonist relations. I am thinking about placing 2 implants. In number 16, where it's extruded, orthodontic mini screws will be used for minor tooth movement. This is a CT at initial visit. You can see that number 47 is quite impacted. In this area, the roots are overlapping. And between lingual and cortical wall, there's nerve. And on this side, between roots, you can see the nerve here. There was high risk of nerve injury during extraction, so extraction was very difficult. As you can see, this is before extraction, and this is after removing number 48 only. Number 47 was extracted. You can see patency here in the extraction. Socket Oss Collagen was used as well as OneGuide. So suture was done for socket preservation. During surgery, I took one panoramic image and intraoral image. You can see that there's nerve here. There was high risk of nerve injury if I were to do odontomy and odontectomy fully, so I just prepped the superior portion and it didn't really go well, so I had a lot of difficulty in doing the extractions. Extraction was done. The patient found it extremely difficult. The only panoramic image was taken. 2 days after, I took x-ray to look how socket preservation was done. You can see this is 2 days after socket preservation. On CT, there's no nerve injury and the patient showed no symptoms. Oss Collagen was used for socket preservation. This is the CT image. This is about 1 month and about 5 months after the surgery. You can see that bone is being formed in the panoramic images. After 5 months, a CT was taken to check the site condition and surgery was prepared, number 46 and 47. On CT, you can see that it has been healed. I talked with OneGuide team. Number 46, because the socket preservation was done. Number 47, I wanted to place the implant slightly more distal. TS3 5.0 by 10 mm and 5.0 by 8.5 mm were to be placed. The BA surface implants were to be placed. Socket preservation was done, but I wanted to gain more stability with the host bone. So in the case of number 46, 10 mm implant was placed deep. In the case of distal implant, 8.25 millimeter was chosen, which is the longest implant acceptable in the safety zone. As shown, implants were to be placed. In the case of number 46, I thought additional bone graft might be needed. OneGuide was used to place these two implants. Healing abutments were connected. This is immediate post-op image. Socket preservation was done, and when I measured ISQ, because the implants were in contact with host bone, the ISQ values were good. In the case of number 46, it was about 75, 79, 47. It is 77 and 77. It was quite favorable. This is CT image right after surgery in number 46, and in number 47, as shown, implants were placed as planned. Oss Collagen was used for socket preservation, and 6 months later, approximately, surgery was done. 2 implants were placed. After 1 month since then, final prosthesis was delivered. You can see the final prosthesis has been delivered nicely. Number 16, the antagonist. Orthodontic screw was used to intrude the extruded tooth. Before surgery, at initial visit, it was quite a complicated case, but I did a socket preservation using Oss Collagen, and final prosthesis was delivered like this. Follow-up is currently being done. I think we'd be able to get good result with long-term follow-up. Let's look at the surgical clip. First, I'm checking whether OneGuide template can be adapted well. After I check, tissue punch is used to remove the gingiva. I'm planning to place 5.0 implants for both sides. Wide type is used. Wide type tissue punch is used to remove the mucosa. I'm removing the template to check whether the gingiva has been thoroughly removed. Because socket preservation was done, I am removing it thoroughly in areas where it's not really coming off. In order to flatten the bone in the area where preservation was done, flattening drill is used. The surgery was done in a traditional manner, so nothing special sticks out. I'm drilling full length to flatten this area. Initial drill is used. Because this is a distal free end case, I need to make sure that the template does not move as I do the drilling. Number 7, 2, initial drilling is done. In the case of number 6, a 3.25 by 10 mm OneGuide drill is used for drilling. Socket preservation was done here. 4.25 by 10 mm drill was used once again for drilling. .0 by 10 mm drill is used. Because I want the implant to be in contact with host bone, prep needs to be done properly on the apex side. Therefore, I used 5.0 by 10 mm drill. TS3 BA surface 5.0 by 10 mm implant is placed after irrigation. Stability seems to be good. I'm placing it 80% with engine. After that, I use implant driver and torque wrench to get the final position. As for the implant driver, because of smart abutment, there is a triangular shape. I'm checking the position on the distal side. Initial drilling was done. 3.25 by 8.25 OneGuide drill is used for drilling. I'm drilling full length. In the distal side, I'm drilling once again with a 4.5 by 8.5 OneGuide drill for drilling. After that, 5.0 by 8.5 OneGuide drill is used. In the case of number 7, I'm checking the host bone. I was concerned there may be issues with the host bone quality. I'm using 5.0 by 8.5 mm OneGuide drill in low speed mode. I'm not drilling full length. I don't want to affect the stability, therefore I'm not drilling full length. 5.0 by 8.5 BA surface implant is placed after sufficient irrigation. Slight under-drilling was done, therefore stability seems to be better. I'm placing it 80% with engine and the rest with the torque driver and hand wrench. The head stability was slightly better. Hand wrench is used as well as implant driver to get the final position. The torque value seems to be better than the mesial implant, about 30 newtons or more. It has been positioned in the ideal position. Smart peg is connected. ISQ value is checked. In the case of number 46, it is 75-79. It seems okay. In the case of distal 1, 77 to 77. The distal implant seems to be good in terms of ISQ value. On the mesial side, additional bone graft may be needed, therefore slight incision is made. Healing abutment is connected before doing the bone graft because we don't want any bone graft going on the inner surface. I'm doing this. In the case of number 7, incision is not made. As you can see, I'm focusing in number 6. In the area where bone formation is still immature, I'm adding additional AOS. In the case of number 46, I'm doing bone graft. I did not use membrane. I did suture. I made a hole using tissue punch originally, so the stability was okay. Healing abutment was connected, but because bone graft was done, I used a shorter healing abutment, only up to the gingival height. This was how I closed the case. The surgery that I've introduced itself was not complicated because OneGuide was used, because the extraction was quite difficult before surgery. The extraction socket was quite wide. Oss Collagen was used for socket preservation, and OssGuide was used on top of that to get favorable results. Implants were placed in that area and favorable results were achieved. Thank you for watching.